Hello, and welcome to the Lone Star Play Podcast. I'm your host, Patrick Scott Armstrong. The Lone Star Play Podcast is produced by TexasRealFood.com. It's basically a comprehensive directory. It's got a list on there of all the best places in Texas that are butcher shops, farmer markets, restaurants, bars, artisanal shops, bakeries, you name it. Any place that's doing like artisanal, organic, all natural, products. That's basically what the site will provide for you. You put in your zip code or your city, and then you can find all the cool places that are near you. It's awesome. And it also has like resources. So you've got different recipes, cool blog, there's videos, going out to places and showing you what it's like, or recipe videos. It's just all kinds of cool resources and cool stuff. So check it out, TexasRealFood.com. You can also check out our podcast on there, TexasRealFood.com/podcast, or you can just go to thelonestarplate.com and it will throw you in there. So I got a special guest today. My friend Jacob Barnes is coming on. He's a cellular biologist. I hope I'm getting that right. That's why I'm wearing these glasses. If you're listening, you can't see it, but if you're watching, you see me wearing them. I'm trying to look smart. They don't actually do anything. They're not prescription. I just wanted to, be smart today, talking with a smart dude. We're just going to talk about the virus and get down to it. So here we go. Let's do this, guys. I don't want to screw this up. Whatever you're doing like right now, what your career is. So I'll let you sort of just introduce yourself and talk about what you do.
Sure. So I think, from my background, I studied cellular and molecular biology at Southern Methodist University and also a degree in general chemistry. I'm currently the director of one of 20 global offices for my company called Brand Institute. We're a company comprised of pharmacists and other doctors, as well as regulatory officials from the highest level in the FDA, EMA, and Health Canada. We specialize in a very niche field that is unknown to a lot of people, and it's around naming pharmaceutical drugs. So what is the name of a pharmaceutical drug? Well, it's twofold. So everybody's seen Tylenol, and then you see this word underneath that is, difficult to pronounce, looks kind of foreign to a lot of people. That would be, like acetylsalicylic acid or acetaminophen.
Oh my God.
Those are non-proprietary names, and that is typically, so there's, in the course of clinical development, there's phase 1, 2, and 3, and so those are for assets that have passed preclinical development and have, the highest likelihood of, success. So they'll put them into phase 1, establish, safety and efficacy, and that's when we will come in and start on the non-proprietary name. So there's a lot of different rules that it's involved in, and companies really don't have the resources to do it themselves. So they use us. We literally named like 85% of all non-proprietary names last year, and we work roughly 75 or 6% of all brand names. And so in terms of non-proprietary name, like adalimumab, there is a process for that. It's very critical to get these names in because you have to, will have like MT37, the name for an asset, but then you have to actually give it the name, right? And it's not a chemical name, but it's a name given by the World Health Organization and the American Medical Association, which is INN and USAN, is affiliated with the health organization, and then USAN is kind of like a little brother for the American Medical Association. So we do all that work. And as things get into like phase 3 and really pushing forward into like those pivotal trials and most likely going to get, that's when they want to work on a brand name. So that would be like Tylenol or Brio. Those types of projects are very different from non-proprietary. It involves a lot of safety and efficacy studies globally. So we have hundreds of respondents all over the world, all healthcare practitioners. So anybody that would have a prescription or order a prescription or fill the prescription, those people are the ones that will take our surveys to tell us if there are any other brand names in existence that even remotely sound like or look alike these names that we're proposing, because our whole job is to prevent medication error. So if you're diagnosed with cancer and you're trying to get a certain type of drug in a hospital and the doctor, confuses it with another asthma drug, it's not going to really do you any good.
I didn't even think about that. Okay, yeah, that makes total sense.
Yeah, there's a lot involved in it. So we're kind of at the forefront of, getting to learn about all the drugs in development. And we work with, major players, I think all of the major players, Merck, AstraZeneca, Genentech, all of those, and then a lot of companies as well, including companies that only have, 3 to 5 people in them.
Yeah.
My territory is pretty massive. It's Texas, Louisiana, Arkansas, Oklahoma, New Mexico, and that is just a lot of ground to cover.
That is a lot of ground to cover. That's a lot. Just Texas alone is
Yeah.
like 6 states, you know.
Yeah, it's ridiculous.
Yeah, that is a lot. So you're not out are you, so you're not in like a lab like with beakers and Bunsen burners, like, I don't know, burning chemicals.
I wish that's my passion right there, but I do get to dabble in the lab a little bit from time to time, but I'm mostly responsible for leading all of the projects that we work on,
Yeah.
and then also, helping with any sort of regulatory guidance and helping them get submission documents in place. There's a lot. It really takes like 6 months to do a brand name project, and it takes roughly maybe 2 to 3 months to do a non-proprietary name. But the non-proprietary name submission, like once we actually get that into the International Non-Proprietary Names division of the World Health Organization, it takes 2 years just to get an approval.
Wow. Holy cow.
So, the clinical development process to get a drug from phase 1 to completion of phase 3 can be, upwards of 7 to 10 years.
Wow. Jesus. I thought the DMV took a long time.
Yeah, seriously.
That's
it does take about that long here in Plano.
Yeah. Does the name, do you guys start to develop the name while the drug is still in like clinical trials, like it hasn't even been approved or anything, or do you wait
Right.
till, so you just start from the beginning sort of thing with
Right.
it?
So the non-proprietary name is essential. You have to, whenever you're actually filing to go to market with your drug, so you've completed phase 3, then you're going to have to submit an NDA or a BLA, depending on if it's a small molecule or a biologic, to the FDA. And a requirement of that process is to have a non-proprietary already approved.
Okay.
That's
Okay.
essential to get started. That's
Yeah.
2 years.
Especially since it takes so long, right? Like you said, it takes so long. So the sooner the better, right? I mean, makes sense.
Correct.
Yeah, that makes sense. It's so basically, the thing is you're just trying to not have 2 Tylenols out there or 2 Advils or whatever, right? Like you don't want the name. You can't have something that's like Bylenol or something, right? I mean, that's basically the gist of it.
Right. In terms of the brand name, yes.
Yeah, the brand name. I mean, because that does make sense about it getting confused, and I could totally see a doctor, if one letter's off or whatever. Yeah, I never thought about that, but that absolutely makes total sense. And there has to be so many drugs out there, right? Like, holy cow! Like coming up with the names and just that's kind of crazy, to be honest with you. Do people like want to try to like name them after themselves or their dog or something stupid? I don't know. Do you get like requests? Do you get like requests and shit like that?
Oh, yes. Yeah.
Really?
We get some interesting requests, man. I worked on a non-proprietary name. We just finished it like in November, and it was a company in New Orleans. And so the stem, which is like the end of it, was kind of set, and so we got to play with the prefix in the name. And so the ending is columidine, and we did at the prefix we did NOLA, so NOLA colimidine. They love
Got it. Oh, that's
so
cool.
yeah,
That's actually pretty cool.
yeah,
Uh,
gives them some ownership, and
yeah,
while they're on patent, there won't be any other drugs out there to you know to be a competitor. But with
yeah.
patent, like there's lots of different drugs you can get with acetaminophen in it. Um,
I see.
Tylenol, and there's Walgreens brand and CVS brand, but
Yeah.
ultimately the main ingredient.
Let me ask you this, because this is my first thought, and I know a lot of people are going to want to know the answer to this, dude. And maybe you know, and maybe you don't. But are really the drugs that's like CVS brand or HEB brand or whatever of the regular drug, are they really the same?
It's a great question, and
Because I always buy those brands, the
in terms
lower, you
of
know.
yeah, so it's kind of a twofold answer. If we're talking about Tylenol, yeah, it's the same. You just have to make sure it's the same ingredient, which is acetaminophen or acetylsalicylic acid or ibuprofen or whatever.
Yeah.
Make sure the milligrams are the same because those are what's called a small molecule drug. Um, then we have other larger drugs like protein based, which are called biologics.
Okay.
Once you make a biologic and you get that approved, Humira is a great example of that. It's the most profitable drug of all time, developed by AbbVie,
Wow.
and it came off a patent, and everybody jumped at the bandwagon to try to replicate it, but you can't replicate a biologic. Each formulation is going to be different. You have to have it has to be at least 90% of what the other biologic is in terms of its makeup, but
Got it.
will never be identical.
Got it. That makes a lot of sense. Basically, what I mean, just to put it in layman's terms, right, for our listeners, like basically, basically the one that can be replicated is just a simpler, setup, just maybe a couple ingredients or whatever, and the other one, the biological, you're saying is just more complex, right? Just more things and harder to replicate. Is that sort of it?
That's the gist of it. Yes.
Okay, right on. And that makes total sense. That absolutely makes total sense. I have always wondered that, like literally my whole life. I can't, and I know people listening and watching this are thinking the same thing. Who hasn't thought that? Because a lot of times it'll be half the price sometimes or considerably cheaper, and I always think, am I just paying for the brand, right? Just for the name of it? Or am I going to screw myself on this, because it is medicine. I mean, you are trying to make yourself feel better. I haven't really had any bad luck with that, to be honest with you. Now then again, I'm just getting like you talked about, Tylenol or Advil or something, and then the whatever brand, and then maybe some like cold and flu medicine, right? Like I'm not getting anything crazy. Do they make? I guess, does every drug have different version, like tiers of cost, like versions of it or something, or not all drugs are like that? I know you said that they're all individual, but do they try to make knockoffs of a lot of different drugs that we don't even know about?
So knockoffs.
I guess not. I don't know the word to
Yeah,
use.
I
It's
mean, it's competition, right? And
competition. There you go.
it's what you would call like for biologics, they call them biosimilars because they're not identical.
Yeah, I like that.
And
Biosimilars. That's spot on, actually.
exactly. And then for small molecule drugs, which is a large majority of what people would be prescribed or take, those are mass produced once they go off patent. So at that point, I mean,
Yeah.
identical, and there's going to be a lot of people that'll duplicates of it, but those are what you would know. That's what you would call a generic.
A generic. There we go. That's the word I meant to use. So what do you, I mean, just like personally, do you see that as a good thing or a bad thing? I mean, in my mind, I see it as a good thing. I mean, I guess that's part of capitalism, right? In our country, even the healthcare department, it does create competition. It does have people fighting to get the best drug out there. Or does it dilute everything too much and then it's just too hard to pick the right one?
Yeah, it's definitely a good question. For me, I think it's a little jacked up the way that it is currently, just because the people that are actually getting a novel or a brand new drug approved that's not ever been on market Those people put in years. We're talking no less than a decade.
Wow. Holy
And
cow.
that's just for that one particular drug. They
Yeah.
had hundreds of them that were similar, and that was the best one. So think about all the work they're putting into these hundreds of molecules, and they're selecting their top, one or two and pushing them into clinical trials.
Oh.
7-year period. Then to get through clinical trials, it takes millions of dollars.
Because you've got to get you mean like human clinical trials, right? Like
Correct.
yeah, okay, that makes
You're
sense.
having to manufacture the drug. You're having to, pay for the studies, all the people involved in the studies, and that's before you ever even know if you're going to make a dollar.
Oh my God. Yeah, that's crazy.
So
What a business plan, right? That's like a
exactly.
that's crazy.
So for me, it's twofold, right? Like I understand all the work that goes into it, and I see, once they actually go on market, they're there for, X number of years, 5, maybe 10 years most, before they're going to start seeing competition in there. And that is when that little window is all they have to make money off of it. So it's kind of twofold, right?
Yeah, totally.
You want things to be cheaper, more options, more affordable. Look at things like cell therapies and immunotherapies that are out. Those cost thousands and thousands of dollars, but you only take them once.
Got it.
It's preparing you like at the cellular level. That's the kind of science I'm really intrigued about. But they need to find a way to make it more affordable for people who have the means.
Do they do the same thing like in Europe, or do you even know? Is it like, medically, like drug wise competition? Is it the same over there?
So, it's all kind of the same around the world, but you have to look at, in terms of getting like names approved, there are 30,000, give or take 100, 30,000 different brand names approved in the United States. There are 90,000 approved in the EU.
Oh, wow.
Last year they incorporated something called Article 57, which instead of each of the individual countries having their own little system and brand names, they combined all of them in the EU. So it's 24 countries that got into one.
Wow. Okay. That is crazy. And there's even some countries that are outside of the EU, like on the Eastern Bloc, and obviously UK now. So UK's got to have. I wonder how that medically works for them. Are they, is their program still going to be part of the EU, or now they're going to have to do their own thing, again? Like that's kind of crazy too. I didn't even, how it affects that. I mean, I lived in Spain for a few years, and I just don't even remember that, to be honest. Like I just remember all the medication being, everything seemed very, I don't know. This is going to sound so stupid sounding, but like everything, all the medication just seemed very medical, like all the labeling, all the, when you went to the pharmacy, there weren't any like fancy, colorful bottles and, animals on the front, like, just like weird shit. It was just all, simple labels, and you would talk to the pharmacist and tell him how you're feeling, and he would give you the medicine. It wasn't like you just look through and get stuff. You know what I mean? Like, it's all in the back and stuff, and they bring it out to they get you what you think you need or whatever, and there wasn't a bunch of options. So not that I remember anyway. Now then again, I didn't get sick or anything over there, so I mean, besides like getting a cold or a flu, right? So I would just take whatever the whatever was, but it just seemed very different process. Like they don't have all these ads for medicine and stuff like they do here. It just was a different, just different, but I was curious about that over there. Even though I lived over there, I still have no effing clue, what it was. Just because, again, it's not that I was involved with any of that, so I just never really paid attention. I do remember this one funny story though. I hadn't taken any. I'd probably been in Spain like, I don't know, 4 or 5 months. I had never taken any medicine there, and I was working a job on the beach, and I got sick. And I remember my boss giving me this little packet, and it was powder. And I said, "What is this?" He said, "Take it. It's like Advil or something," but he called it paracetamol. And I was like,
Yep.
I'd never heard of that. Where I was like, dude, I don't know, man. Like, I'm in a country. I just try to take this. Am I gonna be allergic? I popped it in my mouth, and everything started to go numb everywhere. And I thought, oh my God, I'm having an allergic reaction. Like, I'm about to die. Like, I just started to get real anxious and whatever. And then it just sort of, went away. But like, we don't have stuff like that. Like, we don't have some powder you just like pop in your mouth, and like it worked actually. But at first it scared me because I don't know, maybe we do have it here, but I never bought anything like that. We usually just pop pills and,
Yeah.
you know,
Well,
and
it's that's just aspirin or Tylenol. It's literally the same thing.
yeah, totally. I found out later, but at the time I was like, what is going on right now? Because I'd never taken aspirin that way or Tyler or whatever it was. Like, it was such a weird feeling to just pop the powder in your mouth, and that's how they take it, and just everything went numb, and it just felt weird, I thought. And now I have no problem taking it like that, like no big deal, after a while. But yeah, it was a little weird. It's crazy. So look, man, with everything going on with this, and not that you're offering any sort of professional advice or anything like that, but I'm just curious your opinion. I mean, your opinion on, the coronavirus and how this is. You definitely have a different angle to look at it than the normal person. Not saying you deal with viruses, but you're going to know more than like me, for instance. So I'm just curious what your thoughts are about it, what you want to talk about, if you have anything to say about it. And then I do have a couple questions, but I'd rather just start there if you have anything you want to say about it.
Sure. So it's a crazy time to be alive right now.
Yeah. Yes.
Very unprecedented, and from a scientist's point of view, it's interesting but scary.
Yeah.
Mother Nature is literally the most diabolical serial killer there is. I mean, Mother Nature is constantly mutating and evolving in a way, and like always 30 steps ahead of us.
Yeah.
Always playing catch up, and just trying to treat symptoms, and in some other cases, trying to eradicate certain disease or viruses, what have you. I think that a good place to start with this conversation is just kind of the difference between a virus and a bacteria, right?
Yeah, absolutely. I don't even know the difference.
So antibiotics are what people take for any sort of bacterial infection. Bacteria is completely different from viruses in that it's composed of cells. Cells.
Which is the virus or the bacteria?
Bacteria is composed of actual living cells, and these cells are all able to eat and replicate, and it's a good thing. There's good and bad bacteria, right?
Oh, yeah, that's true. Your stomach, right? Doesn't your stomach have good bacteria?
Yes, absolutely. And so the difference between a bacteria and a virus is that the virus is different in that it kind of floats the line between living and not. Very interesting. So viruses at their core are very small. So they're smaller than bacteria, and bacteria are smaller than cells, human cells.
Wow.
Viruses are tiny. You cannot view a virus with a standard light microscope. You have to actually use an electron microscope to view viruses, but they do come in really cool looking shapes like popcorn and very spherical types of shapes and very edgy looking shapes. They're really neat just to be looked at.
Yeah, that's such a scientist thing to say, right? Like, I love that.
Yeah.
I love that. I love that.
Essentially, viruses are a blank shell composed of a protein, like a coat of protein, and they also have a lipid membrane that surrounds that protein coat. And then on the inside is nucleic acid. So it can be either like DNA or RNA. And what that is and why that's important is because it's basically genetic instructions. DNA and RNA are what is communicated for cell replication.
Got it.
So each virus is programmed with its own little message of genetic instructions. So once it is actually able to get into your system, its entire goal is to attach to a cell. So it attaches on the outside of a cell, and then it communicates to that cell on the outside, and it communicates inward about how it wants to replicate. So the interesting thing about COVID-19, coronavirus, however you want to say it, is that it actually works similar to HIV, and that's scary. The reason,
Oh, wow.
So HIV works by ultimately invading your T lymphocytes. So your T lymphocytes are extremely important for thwarting any sort of foreign invader in your body.
Is that what they call T cells?
Yes.
Okay, I have heard T cells before. I didn't know what that meant. Okay.
And so HIV actually replicates extremely fast. It literally injects its mRNA into your cells, and then your cells happily make more of it.
Wait, the virus has its own like DNA?
It has a message, a single strand.
A single strand, like you said, the instructions of what to do. Like, boy,
Yeah.
that's scary.
It tells each of your cells how it wants the cell to work. So like
it basically makes all your cells traitors.
Yeah, I mean the cells they don't really think. They go based on signals.
Okay.
Little protein signals on the outside of each cell. And
well, I mean, I realize they don't like think like like have like oh, did you see the new Walking Dead? Like talking to the other cell, like I get that. Like
yeah.
All right.
So
Sorry.
ultimately, it's attaching to the host cell, and then it's injecting its genetic material to recruit the host cell's enzymes, and those enzymes make parts for new virus particles, and those new particles assemble the parts into new viruses. The new particles break free, and then they break free from the host cell, and they find a new cell. So that you will start to elicit immune response. And there are two types of immune responses. There is innate and adaptive immunity. Innate immunity is the first line of defense against pathogens. It's a non-specific immune response. So basically, it consists of physical, chemical, or cellular defenses against pathogens, and its main purpose is to immediately prevent the spread and movement of those pathogens throughout the body. The second line of defense is the adaptive immune response. And so if you've had any sort of illness, a cold or the flu in the past, your body has already made antibodies that will ultimately, they're programmed. So like each of your cells is like a little computer, and as you're getting sick, your body is learning about it. So when you get sick with that same exact thing, it has antibodies to heal you or make you not show any symptoms at all or not get the illness at all.
Wow. Okay.
Yeah, so very, very interesting how the body works.
Absolutely. That's super interesting.
Yeah, so the adaptive, immune response really it's more of a long-term type of response.
Yeah.
The innate response, the initial response is just very fast, and it's like, okay, let's throw all this stuff at it and see what we can do, and then the body's not responding, and so then it goes into the adaptive space, and it's starting to actually program antibodies.
Wow, dude, I mean, I knew our bodies were amazing, but that's just another amazing thing to hear that our bodies do. Like crazy. That's just so crazy. I just did not know that. So the coronavirus basically is doing that then, right? It's
Right. So again, to tie it back to HIV, it's similar in that HIV is, one of the only ones that we know that actually injects itself into the cell, and in the cell, uh, not happily, but readily makes more copies. Uh, COVID is different in that it actually inserts the same way into the cell, but then the cell aborts it. So at the end of the day, it's not going to mutate as fastly in the body. However, it's still going to make new virus particles. So ultimately,
amazing.
um, to kind of get into where we're at today, there's 18 different treatments or vaccines in development, and those will not be ready anytime soon. I think the earliest would be probably the beginning of next year, and that's extremely fast tracked.
Oh, really? Like that's just development, you're saying?
No, that's clinical trials.
Oh,
So
okay.
there were already molecules that were in development or about to be in development for other indications. And when I say indication, it's different diseases or viruses or what have you.
Yeah.
And so we have, I'm sure you've heard of like remdesivir or um,
Uh-uh.
chloroquine or hydroxychloroquine that
Yeah, yeah, I heard the president
about.
talk about that.
So quinine is what's used to fight malaria. And so you can kind of see chloroquine is very similar in the name. So chloroquine is actually intended for like anti-malarials, and they're hoping that it can be used, um, to fight the symptoms or at least shorten the treatment time for coronavirus. Uh, from what I've seen, it's not too promising,
Yeah.
but you never know. The good news with like kind of where we're at today is kind of twofold. We've studied this before in terms of coronavirus. We have studied previous, SARS slash CoV.
Okay, let's define coronavirus real quick for people, just so that if, in case they don't know what that means, because I think a lot of people think coronavirus is just the COVID-19, and they're the same thing, and one is naming like COVID-19 is a type of coronavirus, right? Because coronavirus is just a generic term, right? It just means new virus or something like that.
So coronavirus has been known to us for a long time. I actually studied it at SMU. What was that? 12 years? Jesus. Um, and there's also SARS, right? So just different types of viruses, and they're inherently infecting like pigs and mice, not mice, but like bats. And a lot of these infections or outbreaks typically happen in underdeveloped areas, such as like India or other places in Asia. Uh,
Yeah.
typically, where we'll see these types of outbreaks, but this is different, right? So there's different types of coronaviruses. Coronavirus is actually a large family of viruses that are, common in people and different species of animals, but um, rarely these coronaviruses that are in animals infect people and then spread between people. Um, so back in like 2003, we had an outbreak of MERS and coronavirus. So it's like a little combination there. And now um, we've also had SARS-CoV-1, and now we have SARS-CoV-2. SARS-CoV-2 is what's widely known as COVID-19 or coronavirus. Coronavirus is a blanket term for a lot of different viruses in that family. So that's why people kind of reference it to COVID-19, because SARS-CoV-2 is just kind of weird to say.
Okay, so that's the same thing. SARS-CoV-2 is COVID-19.
Correct.
I didn't know that. Okay. Okay.
And so we actually looked at developing vaccines. What was it? Like in 2003, we tried to develop some vaccines because we wanted to thwart that in case it did spread. But there were tons of different vaccines or treatments put through the clinical development pipeline, and none of them were effective. They were animal models, but they weren't effective. And
Yeah.
So that's the bad news.
Yeah.
We've studied it and we've been unsuccessful to date, but have also changed a lot scientifically since 2003.
Yeah, sure. So you said there's 18 potential vaccines that are developing right now.
There's a lot more than that. And
Yeah.
in clinical development, there's 18 different treatments.
Gotcha.
Treatments are different than vaccines.
Got it. Okay, I see.
A vaccine is basically like taking a small portion of a virus and like volunteering to put it inside of you so that your body can have the adaptive immune response we talked about earlier if you become infected.
Oh, I didn't know that. Oh, really? That's what a vaccine is?
That's what a vaccine is.
Oh, shit. Damn. Oh, okay. I didn't. So when you get the flu vaccine, they give you the flu.
They give you a couple.
I mean,
they give you a couple different strains of it. They're not giving you enough. They don't give you enough viral particles to necessarily make you sick, but you can feel fluey for the first.
Yeah, totally. I mean, that's happened to all of us, I think, a little bit here and there. But that's interesting. Okay, so. Oh, that's interesting. Well,
on that topic of flu vaccines, I never get it because there's nothing better than you can do for yourself than to practice good hygiene.
Yeah.
So I open doors with my shirt, or I wash them. If I touch any door handle, I will go straight to a sink and wash my hands. It's
oh my God.
Transferring anything
Sure.
to your mouth or nasal passage. That's really how you get viruses. And so viruses can live on different surfaces for different amounts of time. Coronavirus, for instance, if you cough or sneeze, it's going to be like in your living room and you cough or sneeze, and then somebody comes in there 30 minutes later, they can literally breathe in those viral particles that are still floating in the air and contract coronavirus.
Oh, shit.
If somebody coughs on their hand and touches a rail, it can literally live on that rail for like up to 4 days, I think.
Holy cow. Oh my God. And rails and stuff aren't getting cleaned. You know what I mean? It's not like
they're being cleaned a lot more now than they.
Yeah, I mean that's a good point.
But,
that's a good point.
It's scary. Right?
Yeah, it is scary, man. It's got to be even scarier for someone like you who knows the actual truth of shit. I don't even know how you get up out of bed in the morning knowing what's out there in the world that can kill us. You know what I mean?
I know a lot of deadly things, and I've convinced myself a number of times that I had them. Like when I was studying parasitology in New Mexico for a few months, putting together like all the research for a publication. We're studying Paramiscus maniculatus, which is just a common deer mouse. And so we were catching hundreds of them and then collecting them and looking for specific parasites in them, but that's not really what I was bringing this up for. These deer mice, in their feces, there's something called hantavirus. Hantavirus is one of the most deadly viruses that we have in existence.
Sure.
So a mouse has hantavirus and it defecates somewhere like in your cabin or whatever, and then you go to sweep it up, and somehow these virus particles from its feces get into the air, you breathe them in, and you contract hantavirus. This will literally kill you within a few days.
Jesus Christ.
Yeah,
dude.
and there is no cure.
Oh my.
And
God.
I was working with so many of them, and I ended up getting really, really sick one day. And they, they took me straight to the emergency room and they tested me. And when I say tested me, they had me crap in a cup and give it to them to study.
Yeah.
And I was just
How
sweating
embarrassing,
bullets.
right? Yeah.
Like, I'm sitting here thinking I'm going to die like in the middle of nowhere.
Oh no! Studying mouse feces. You're like, this is not how I want to go out.
Yeah, but
Right.
I didn't have it. Although I had a lot of those symptoms, I lucked out on that one.
Oh my God, dude, that has to be so nerve-wracking for scientists, and if you're studying it or whatever, you're in the lab, you're dealing with these virus. Like, I can't even imagine. Like just working in a kitchen and like having a good steak you don't want to fuck up is enough pressure. Like, I can't even imagine having like some deadly ass virus you're like playing hot potato with. Like, oh, forget it, dude. I mean, so much respect to the medical community right now. Just shout out to all professionals on the front lines, professionals in your field that are going to get us a vaccine and some drugs and treatment later, right? Like, that's the long-term game. It's like everything's being handled right now so well from the medical side of things, at least from my perspective. I have an aunt who's a nurse in just outside of Atlanta. She's working 7 days a week, just all day long, trying to help people, whatever, same story you've heard. So this is crazy, man. This virus is crazy. Like, what, when you hear something like this is what I've asked every guest that I've had on since I've started this virus, testimonies or whatever, everybody I've talked to. Like, what was there a day or a moment when you knew that this was serious?
I knew it was serious. Literally the first I learned about it, and this was before there was ever a single patient in the United States. I saw how fast it was changing or replicating amongst people in Wuhan, and I also, was digging into that and kind of getting a feel for how much they were actually divulging, because once it becomes news, it's happening weeks before that.
Yeah, that's a good point.
Like, there was an article I saw just yesterday that the first death we had in the United States was, I think, Washington, and the person that actually died from coronavirus died 3 weeks before that in the United States.
Oh my God.
That was 3 weeks before we even knew it was here.
That's crazy.
Already dying from it.
Yeah. I mean, I mean, I have to believe that some of those numbers are just a little off, just because for that reason. I mean, there's probably a lot of people, testing isn't that widely done in the US. So there has to be people that have had it and we don't even know about it. Right. So to me, the cases are even more than we know.
Yeah.
Right. I mean, and then it's just crazy. And these numbers are insane. Do you see the protocol as, for social distancing and shutting down places? Do you you believe that's the right protocol that we're doing?
That is the only protocol. If you care about, grandparents or children or even yourself, it's not specific to age about who's going to die. There are healthy people in their 20s, 30s, children, all dying, and it doesn't just people with their medical history. It's really anybody. What's happening, very scary, but at the time, what's been implemented to keep us apart, it's just kind of mitigating the problem. I want it to become too serious all at once, because our medical facilities, they can barely handle it as it is, right? People that go on ventilators, the large majority of them never get off. They die.
It's horrible here.
So, like, what's happening with people kind of fighting this stay-at-home order, and they're saying, you're taking our rights away and things like that. Sure, that's one way to look at it, but it's a very, very selfish way to look at it.
Yeah.
Ultimately, if we start integrating everybody, like right now, it's just going to infect literally everyone. And this is a big problem, right? Because the people who are getting it and then recovering, if you time, typically your body should make it, not as severe. It's actually shown that it's more severe. You get it a second time. That's what the data's been showing recently.
Oh my God,
Also,
that doesn't sound good.
no, it's not. And also for men, men are much more likely than women to contract coronavirus. The split is something like 60-40. And that's just, we think it's because, women have different chromosomes than men. And
Yeah.
they actually have a stronger immune response than men, just in general. So we think that's kind of why, but a lot.
I read an article, and this, this is your chance to be Snopes.com. I read an article, on Facebook, of course, it has to be real, but it said that potentially the reason that maybe men are getting it more than women is because of our testicles. Not to be gross, people, but I'm just trying to use a medical term. Your testes, your boys down there. I guess it's not connected to the immune system, and it can linger in your testicles longer, so you might have it a couple more days than a woman. I don't know. That's an article I read.
Yeah, I don't know about that.
I'm so glad I asked you that, dude. Because I sound like an idiot saying that. That's what I read. I mean,
that's a bit far-fetched.
Okay. Well, I know a lot of people have read that, so they're probably thinking the same thing. Like, oh, I don't want anybody cutting off their nuts right at home,
Yeah,
like
no.
thinking, oh, that's going to save me. I'll just, do that. Okay, so please, if you've read that, just ignore that.
Yeah, I mean the ratio between men and women is accurate. It's like roughly 60% men who've been infected with it, and 40% women, and
Yeah.
that's wide. That's not just here.
Okay.
So what's interesting is, the people that are working on potential therapies, there's something called the cytokine pathway, and it's like going to the moon and starting to really look at it, right? We have not fully understood the cytokine pathway. So cytokines include, things like interleukins, and interleukins are basically the forefront of our immune response, right? They're like proteins that kind of communicate to the body and start to get different types of immune responses going. So specifically, we're looking at the interleukin 6 pathway as a way to reduce inflammation, because the interleukin 6 actually is a pro-inflammatory cytokine. So what's happening with people's lungs is inflammation, right? And when you have a lot of inflammation in your lungs, it's like having asthma, right? So people with asthma or COPD are more at risk. They already have that inflammation. They know what it feels like, but when it becomes too inflamed, you can't breathe.
Yeah.
You can't actually physically get air into those alveolar spaces. So we're looking at the IL-6 pathway as, for different treatment options to turn off. If we turn those off, maybe there won't be so much inflammation. Maybe we can, reduce those symptoms, and that would be a major victory.
Absolutely. That's definitely something I've read and heard about, people like that being one of the main symptoms, not being able to breathe, having that issue to breathe. I've known a few people that have had the virus, and that's definitely all of them. They all say that, right? They've all said that particular thing. I've even known some people that have passed away, unfortunately, from the virus.
Oh, wow. I'm sorry to hear that.
Yeah, man, it sucks, dude. The virus is anybody not taking it seriously, like in my book, like I'm done being Mr. Nice Guy. Like, I'm sorry, but holy cow, like it's real. it's as real as can be. So, again, I talk to people all week long that deal with the virus and how it's affected their business or this or that, or what they're doing to help the community, right? So like, it's real. I think for the people that maybe, like you said, I just don't know it's selfish, right? They're just thinking about their life and where that's going, and that's it, but at the same time, you can't do that, because this situation doesn't just affect you. That's the problem with this. I'm all about do your own thing, freedom, live your life. I don't care, right? I'm absolutely, but this is something that, I'm sorry, but if you go out, you could kill me. So it just, we can't have those same freedoms. As much as I hate to say that, it's just not the same right now. And I'm just done with people like not taking it seriously, and just being nonchalant and wanting to get back out there and just do whatever. And like this Las Vegas mayor, I don't know if you saw that interview where she like literally offered up the city of Las Vegas as a control group to see if it'll work. Like,
Right.
well, we'll test it for you. We're willing to, take some lives for it. This is how the mentality. Even our lieutenant governor of Texas has said that getting our economy back is more important than life or something. It's like, what? There is no economy without lives in it. Like, what kind of economy are you going to have? Everyone's dead. Like, it
Yeah. I
makes
mean,
no sense
it's
to
not
me.
going to kill everybody,
I mean, not going to
but
kill everybody, but we don't know, right? That's the problem. It can get past to this person, and you don't know how their body's going to respond to it. And
right. It's about, you're putting yourself at risk, and you're putting people that you love at risk, and you're putting people that have people who care about them at risk that you
yes,
don't even know.
yeah,
And the thing is, the scariest part is that you can get the virus and be sick as hell, and then I can get the virus and never even know I had it,
how
because
how
it's
crazy is that?
it's called being asymptomatic. That's the scariest thing that we're facing right now, is that people still going to work and going out that are infected, literally infected with coronavirus, spreading it to others, and they don't even know they have it.
That's crazy.
In addition to that, you don't have to have symptoms to spread of this virus or any virus. Um, you know, this particular coronavirus, I've been reading and hearing that it can actually spread 2 to 3 days before you show your first symptom. So that means you're able to spread.
Oh,
It's like being asymptomatic or spreading before you have symptoms and not even knowing you had it. Like that's dangerous, right? So
totally. Because how would you even know to, you know, quarantine yourself, right? Or whatever the steps you need to take. Like, you wouldn't even know to do it. So a lot of time, and that's why you're saying social distancing, flattening the curve, getting it to where our health system can handle the load of people coming in, right? I mean, that's basically the idea. The idea is, look, we're all going to get it, or some of us are going to get it, but we just can't all get it at the same time, right? We got to basically spread it out throughout the year, I guess, and you know balance it out to where the hospitals can handle people coming in and going out, and people slowly develop the antibodies and whatever. I mean, I guess that's the idea, right? It's just sort of spreading out the madness.
yeah, I mean, in terms of this whole ebb and flow of the virus, it's going to slow down in the summer, just because viruses typically don't thrive in heat,
Okay.
handle too extreme of temperature.
Yeah,
You don't see a lot of flu and stuff like that in the summer.
that's true.
When we get back to November, that's when this is all going to ramp up just the same as it did the first time. And
Oof.
so it may be okay to get back to work here in the next month or so. There will still be cases, and people still need to be smart about keeping a little distance between yourself and anyone around you.
Yeah.
Not shaking hands, obviously, just bump elbows or whatever.
I mean, that's probably the smartest thing to do, right? Wash your hands all the time.
Yes, absolutely. Ideally with hot water if you can stand it. The best way to go about it. A lot of people are using Purell and things like that, but those are those typical antiseptics. Uh, they're So antiseptics are what will actually prevent or destroy like a virus on your hands.
Oh, okay.
It's really not working against coronavirus.
So like, so I have this, right? This is just hand sanitizer and it says 70% alcohol. And then I have just rubbing alcohol, which actually it says 70% as well. But I find using just the rubbing alcohol I've mixed it with rosemary. That's why it has that color. Um, it's not like my pee bottle because that's actually what it looks like in this video, but it's, it seemed to work the best, but I feel good putting it on. I don't know if it's actually doing anything.
Yeah, I mean, it's definitely like it's getting rid of any other um, potential pathogens on your hands. It'll get rid of a lot of it.
Yeah, right on. I mean, I wash my hands and then I use that like after, I sort of do both. I don't know, I'm just, I guess I'm just paranoid a little bit, right? Like a lot of people just sort of paranoid about it. So I'm constantly washing my hands. They're getting dried out. So I'm having to use lotion too, right? That's a problem for everybody. And this glove thing, right? So, coming from the food industry, like I know how to wear gloves and how to, you know, use those protocols in the kitchen, right? And you change gloves a lot, to be honest with you. But what I'm seeing is people wearing gloves all day long, the same gloves. It's not right, right? Like you're still transferring everything. It doesn't help. In a lot of ways, I think people wearing gloves out is a negative thing. You should just be washing your hands more instead. I don't know. That's my theory on that.
Yeah, it kind of weirds me out when I go and get, like Chick-fil-A or something, and the people are sitting there in the drive-through window and they're all passing things to and each other and then to people in their cars.
Yeah.
There's a limit, actual touch between the purchaser and the employee, but these people are wearing these gloves, and whatever's on those gloves, they're bringing it to every bag they touch.
That's my point exactly. Like they don't, and
The only
even
way
some
to
of
do
the
it,
food places are not changing gloves enough. They're just not. They're wearing the whole time and
yeah.
touching the keyboard, right, and the computer monitor. And then, like you said, they touch the bag, they give it to you. Then the next person comes up, they touch that next bag and give it to this person. I mean, essentially, you'd literally have to change gloves every single time for it to be effective.
Ideally, yeah. I mean, at least
Ideally,
increase the amount, but I mean, there is no perfect way to
yeah,
spread. It's an airborne type of deal. There's like you can't,
that's
and you
crazy.
can't see it. You don't see like a little
Yeah.
cloud that says
Yeah.
coronavirus.
Yeah, that would be so great, right? If we could just avoid it that way, like a video game, right? Just R3 and you can like see the environment and see where the virus is at. And yeah, I mean, like you said, people just need to be careful, cautious, even when things open back up and get going. Because today in Texas, they're allowing non-essential businesses to open up. You know, that's happening. So
There's still some restrictions on them, but
yeah, totally. It's all pickup, I believe, right? You can't actually go into the place. But it does increase touch, right? Touching the product that then goes in your car, right? So, and people are just getting out. I don't know. I'm for it, to be honest with you, just because of what it's doing for the restaurants. Like they're allowed to sell alcohol now, like from their inventory and make cocktails to go, and you can, take that home now. So yeah, I like that because that was such a big loss for restaurants and bars, and a lot of them were going to go under if that didn't happen. So yeah, I'm happy about that. I mean, I don't want to see the economy crash too. I get people's frustrations of wanting to go out and get back to work and get back to life. I get it. But I guess it's just if you trust science and if you see the bigger picture and if you care about community, then that's what you're doing. If you don't, then you're doing the other thing, right? I mean, it's pretty simple.
well, when it comes down to it, this should be a huge wake up call for people to get back to basics in terms of take care of your damn self. Wash your fucking hands. Just do it.
Yeah.
Wash it. Wash them so many times throughout the day that you lose track.
Yeah.
If you do that, you're literally putting other people at risk and yourself.
Yeah. Good point.
Every single person gets sick.
Yeah.
And people, throw their hands up. They're like, I don't know why I got sick. Well, I'm like, I know exactly why you got sick and why I don't.
Yeah.
The flu vaccine. I just need to wash my damn hands and not sit around people I can see visibly are sick.
Yeah. Yeah. You're right about right? Like you just touch your mouth, you rub your mouth, you hit your eye, you whatever. Um, yeah, absolutely. And when people aren't washing their hands, I mean, so many people just normally don't wash their hands. But I think you're right. This is a good opportunity for people to take inventory, right, of their life now moving forward and how they're going to treat this. And like you said, take care of themselves and not, and just their, take care of your body, you know, eating right, getting some exercise, right? Like building up your immunity system is helpful too, right? In this.
Absolutely.
Yeah.
Always take care of yourself.
Yeah.
Definitely helps.
Yeah. Damn, Jacob, to be honest with you, dude, I could talk to you for hours, dog, about this. Like I can't remember the last podcast I did where I just wanted it to keep going forever because I have a million questions for you. Like you've been so great today, dude. You've really provided a lot of interesting and insightful information, man. And I just can't thank you enough, dude, honestly. And all your answers were just very put together well and just made sense and easy to understand. And I just really appreciate that, man. You're really gonna, you know, the people that do listen to this and watch this are definitely gonna appreciate it. I know I do. You know, you've opened my eyes to some things I just didn't even know yet. You know, and I'm inundated in this information all the time, but just some things I just didn't even hear about. So again, I might have you back on in a couple weeks, dude, just to go over some more stuff. To be honest, I might even get some questions from people to ask you. So I don't know. Just saying thank you, man. I really, really appreciate it.
Absolutely. You know, very welcome. And I hope if I help at least one person, that's worth it, you know?
Absolutely. Oh, you absolutely
It could
did,
even be
man.
you. I don't even care.
Well, you know what I mean. Yeah, of course, dude.
Yeah, for sure.
Absolutely. Yeah, you definitely helped me. Like I said, there was a lot of stuff I just didn't even had no clue about. You know, and why would I? I don't know this stuff. That's not what I study. But it's great to get your perspective, and it's great to get, you know, someone who knows from their field, right? I mean, it's just that simple. It's literally that simple. I'm going to talk to a plumber about pipes and roofer about roofs and a cellular scientist, biologist about that stuff. I don't even know the right. This feels like a Joe Rogan podcast, right? When he has like somebody on super smart and then he's just like some chimpanzee who doesn't know how to deal with it. Like one time I had an astrophysicist on my podcast, this other podcast that I had. It's literally one of my favorite podcasts I ever done. I mean, I was so intrigued by this lady and what she dealt with, and you know, but the conversations were just, you know what I mean? Just oh my god, the stuff she was talking about was just so intense and so big and so. But I love that stuff. I love learning about it. And I know a lot of people that are listening and watching are very interested in this stuff, even though it sounds very technical and medical, whatever. It's super interesting, and especially right now, we need a lot of that information, man. And it's hard to swim through everything that's out there right now and really pick what's right. I mean, here I am telling you about the nutsack theory that guys get more sick than women. Like, yeah, it's crazy, but I read it, and just like anybody, you're going to think, well, is that true? Is that something? It's, you know, it's just tough, I guess. So thank you, man, for just providing clear, concise information.
Absolutely. And just to put a little caveat there, that's information based on where we're at today. This is something that we do not know a lot about, right? We know a lot, we've learned a lot in the past months or so, but we don't. We're scratching the surface here.
Yeah.
This is something that, you know, all hands on deck. And I have companies that, you know, they're solely focused on cancer drugs, and they have pivoted to nothing but coronavirus drugs. So that's all over the United States. So we literally have, you know, the best and brightest minds really looking at ways to either treat symptoms or prevent the virus altogether, which is ideal. Maybe unlikely, but you know, it's possible.
That's awesome. I didn't know that either. See, that's great. That's hopeful, man. Like that's actually hopeful. Some of these things that you're saying, like it gives me hope. To be honest with you, and it also just is truth, right? A lot of times, a lot of the most frustrating part, and like you said, all this is changing, so things could change. But a lot of the most frustrating part about all of this, for a lot of people, I'm sure yourself included, is just not knowing, right? Timelines, and maybe you know more than most people, but I know for a lot of us, like just timelines, like, well, when is this going to end? When is this going to happen? You don't know, and you can't plan anything. And it's very frustrating, because that's how we live our lives, right? In a calendar and booking everything. And it's just really hard to do some of that stuff right now. And so, I guess the for certain things that we do know are, social distance. Pay attention to the orders, keep your distance. If you are going to go out, keep your distance, wash your hands, stay clean. Those are for certain things that we know we can do, and support, local businesses, support your local health professional. If you know a way, give back to the community, do what you can. If you can donate, things like that. Right. Just anything. If you feel just incapacitated at home, those are some ways to feel like you're doing something. So.
Absolutely. I couldn't agree more. And in terms of supporting small businesses, support small businesses. Do not support chains.
Yes.
Support people that are literally fighting for it. It makes me sick to see some of these loans that have gone out to large companies like Ritz-Carlton, for instance, got like $60 million. It's like, what the hell do you need that money for?
They don't. They don't. Ruth's Chris, right? Shake Shack gave back their $10 million. Thank God.
Yeah, I mean they got a lot of heat for it.
Of course. I mean, Ruth's Chris, I think made $400 and something million last year,
Yeah,
and here they are getting a loan. I mean, same with Shake Shack. Shake Shack had to make almost $500 million, and they asked for a $10 million loan. I mean, it's like,
I think they're in the billions.
It could be. They could be. I don't know.
It's disgusting, but yeah.
It is. It's disgusting. You're right. So, yes, support small businesses. Hashtag support local. Absolutely. Yes, 100%. Well, thank you again, man. I know you're probably working and in the middle of, doing important stuff. This is my important stuff. I just got to make sure my hoodie fits right and that my mic's working. And then this is it. This is as important as it gets. But thank you again.
You're very welcome. I let you go over by almost 30 minutes, so.
Oh, please, bro, I appreciate it so much, man. Like I said, this was so interesting. Dude, I could just talk to you for hours about this. I mean, I love talking to you anyway about anything we would talk about, but especially this, man. So again, dude, thank you so much. Get back to what you're doing.
All right, take care.
All right, bud. Be good.
Bye.
Bye.